Chair, if I may, I'd just like to inquire with the Secretary what progress has been made in regards to the questions I raised yesterday afternoon, early evening, in regards to whether or not there'd been any discussions between the Department Minister, Prime Minister and Cabinet, Treasury and Finance with the Department of Health, and I was just wondering where we were up to in getting that expeditious response.
Senator, as soon as you raise it, we did discuss this with Prime Minister and Cabinet. This morning my advice is that in terms of revealing the deliberations of a previous government, we don't have authority to go there.
So just to be clear, you did discuss it with Prime Minister and Cabinet?
My officers had a conversation about it, yeah.
And what level were those officers, Secretary?
Division heads.
Sorry?
Division heads.
Division heads with division heads in Prime Minister and Cabinet?
And referred upwards, my understanding, yeah.
And you have to speak up because the acoustics is a recurring issue in this room.
Turn up the microphones, yes.
So just to understand, officials in Department of Health at division head level had a conversation with officials in Department of Prime Minister and Cabinet, and the advice that was received, the advice that you're giving this committee now is that that you cannot answer the question?
We do not reveal the deliberations of a former government.
So you cannot rule it in or you can't rule it out?
Correct.
So you can't rule it in or out whether or not the previous government discussed the issue of a GP co-payment?
Correct.
Well, we're using up a lot of
This is
time.
the way you
It's just
defend your
debating.
budget. This is how you defend your budget. That
Just
brings
to
in a GP
just to be
tax.
clear,
Could we just have one person speaking at a time, please?
just to be clear, that the advice that's now been shared with this committee is that you're unable to rule in or out whether or not the previous government did discuss a proposal for GP co-payment.
Well, we established we didn't introduce one, so we're wasting
The
time.
question,
Senator Smith.
and I think what is important here is just that it's a bit unbelievable that if
Your budget
co-payments
is
are in the
unbelievable.
DNA of a particular government, as they were in the 90s, that
Point of order.
when the
Point of
budget was
order,
under
Chair.
such tremendous
Point of
pressure
order.
as it was in the period
Point of order.
2008 to 2013,
There's no question
that the
there.
previous government would not have
Making a
considered this as an
statement
option.
is not
And what
part
we've
of
just
estimates.
heard, what we've
Estimates
just
is
heard
about
is the
asking
Secretary
questions and then
can't
having the
rule
answers,
out,
Chair.
can't
I'm raising a
rule
point
out
of
that
order.
a GP co-payment
You
was
let him just
discussed
keep
by the
going
previous
when I've raised a
government.
point of order.
Yes, Senator Polly, point of order.
Well, it would be, it's common courtesy if a point of order is taken that you hear the point of order rather than let the speaker continue. We have
With
limited
the many
time to
speakers.
actually, we have limited time to put questions to the officers. Making a statement is not part of estimates process. Estimates is about asking questions and listening to the answers. I ask you to draw him to his question, please.
Senator
Polly, I think Senator Smith
That's
is
right.
outlining his question. There is not a point of order, and you might note that the opposition has had all but 10 minutes of the more than an hour and a half
So
that
just
we've
to be-
started
Doesn't mean
today.
you can still make a statement
The second
rather
element.
than ask questions.
The second element of the question was whether or not
effort in
the
defending
figure,
budget.
whether or
Senator
not
Polly.
the figure, whether or not there was a figure that could be revealed in regards to GP co-payment discussions. Was there a response to that answer, Secretary?
I beg your pardon?
I'm sorry, do you want to
This has
re-ask
nothing to do
that
with the
question,
outcome
Senator
that we're
Smith?
dealing with now.
Senator Polly, acoustics in this room are difficult enough without intervention.
A question was asked of the Secretary in regards to what figure was suggested as a proposed GP visit co-payment during that period. And I'm assuming that you're not able to answer that question because you've not been able to rule in or out whether or not a GP co-payment was discussed under the former government.
Senator, this is a little bit like when did you stop beating your wife?
I wouldn't know anything about that.
Well, yeah, I mean, it's that kind of a question. What I said to you, and I'll reiterate it, is we do not reveal the deliberations of the former government. That applies to the previous Howard government, it applies to the Rudd-Gillard government, it applies to the Hawke-Keating government. We do not reveal those deliberations. That is all I can say.
In your evidence yesterday when we were having the discussion, Secretary, you said in a broad context, Mr Dr White, in a broad context, he has raised the issue in a discussion.
No, I did not. You were actually discussing this budget process.
Point of order.
Point of order.
The question was, in his capacity as Secretary of Department of Premier and
Senator
Cabinet...
Smith, there's a point of order. Senator McLucas.
We were meant to start with Health Workforce Australia at 11:15. My coffee was being delivered at that very moment, and Senator Smith has taken an opportunity to jump in, and that's not unknown. But to now badger on for 6 minutes, I think, is pushing it a bit too far. Let's move to Health Workforce
There is no
Australia.
point of order, and I suspect that this is Senator Smith's last question in this area.
Just to be clear, that we're not able to rule in or rule out that a GP co-payment was was discussed under the former government.
Why do you keep undermining her?
So let's also
Nothing to do with it.
Let's also be clear, Senator, you just quoted allegedly something that was said yesterday.
Yes.
So there is no misapprehension about it. I do not wish this to be misinterpreted or misrepresented. There was no discussion that I referred to with Dr Watt, who is the head of Prime Minister and Cabinet, in relation to any of those matters, because I cannot comment on those matters in relation to the previous government. We did have a conversation in this budget context about discussions which inevitably involved Dr Watt as the head of Prime Minister and Cabinet. But as I've just indicated to you, the advice, as I suspected would be the advice, is we do not reveal the deliberations of former governments, and I have made no other comment in relation to that matter.
So just to be clear, the response that has come back is that you cannot rule in and you cannot rule out.
No, Senator, that is not the response as it came back. I don't actually usually suffer from ambiguity, so I'll be clear again.
Agreed.
I am not making a comment about ruling in or ruling out. I am making no such statement, and I do not wish to be misrepresented. I want to be very clear. I cannot make any comment about deliberations of a former government. Period. Full stop.
Senator Smith, make this your last. Is this a question? And please
So the
make it your
discussion
last.
between division head officials at Department of Health and Department of Prime Minister and Cabinet this morning was what?
I'm not going to go any further, Senator. I've given you the answer to the question.
Thank you very much. Thank you, Chair.
Thank